Hi Lucy, my name is Catherine Wolcott, and I am a behavioral specialist here at the Family Medicine Department and work with the Family Stress Clinic. And we're actually meeting with all the family medicine patients who take medicine for chronic pain. And that's because evidence tells us that the management of chronic pain is most successfully treated and managed when it uses both medicine and other kinds of treatments. So our goal today is working with you and with your doctor to help reduce your pain and improve your quality of life as much as possible. Any questions about that?
Well, I mean, my doctor didn't really tell me anything about this. Like, he just said that it was part of the requirement for like getting the narcotics for my back pain. So, like, what are we doing? Now?
Sure.
Like, what are we gonna do?
So it's probably a little confusing because you're like, I didn't even know you were coming in. What am I doing here?
Yeah.
My doctor didn't let me know about this. Yeah, so I can see how that would definitely be confusing. And like I said, our goal here today is to come up with additional strategies in addition to the medications that can help you manage your pain.
Okay.
And so that's what I'm here to do today.
Okay.
So we talked a little bit about this, but how do you feel about talking with me here today?
Is this like a one-time thing, or do I have to like come back a bunch of times?
So this will be a one-time visit with you and me, and then your doctor will follow up on your progress and kind of review it with you at subsequent visits.
Okay, that's fine.
And then, you know, sometimes if you were to change a primary care doctor or switch, you would have to, you know, review the plan or generate another plan.
Okay.
Same thing after, I think it's a year is the current clinic policy.
Okay.
Okay, any questions?
Yeah, that's fine.
Okay. So how do you feel about talking about some of this?
I mean, I feel fine. Like, I have no problem talking about like my back pain. I'm not really sure what we could possibly come up with that would be that helpful, but I mean, I'm like open to talking about it. It's fine.
Okay, so feeling ready to talk about it, but not sure if this is going to be helpful or not.
Yeah.
Okay. Before we start, I just want to have you answer the question on this paper, with 0 being not confident at all. So, right, 0 being not confident at all, and then 10 being totally confident. Mark on the thermometer how confident you are right now that you can manage most of your health problems. Okay, so if you could just circle on there for me. Okay, so that's an 8. Okay, so before we decide on any treatment, let's set some goals, because we know that people are likely to feel better and get better when they have specific goals that they're working towards. So I want you to kind of think a moment about a specific way that you'd like to feel better. For example, some patients, their pain is at an 8 every day, and it would feel a lot better for them if 4 times a week their pain could be at a 6. Something like that, a specific goal of how you'd like to feel better.
Yeah, let's see. I wish I didn't have to wake up and take pain medicine in the middle of the night sometimes. Like,
okay, so you'd like to feel better by sleeping through the night?
yeah.
Okay.
Yeah, I probably get up like 2 or 3 nights a week now and have to like redose because it's like that bad. So I'd want to just be able to sleep through the night. Yeah.
Okay, so you'd want to sleep through. The night 7 days a week. Would that be reasonable? Would you want to do it 6 days a week?
6, I guess. Sure, that's better than now. So
Okay.
that's fine.
Okay, great. That sounds like a goal that would really help you, and then also sounds manageable or reasonable given where you are now. And what's one specific thing that you'd like to be able to do more often or more easily that your back pain gets in the way of you doing?
Yeah, well, that's getting back to running, but I really don't think that's ever going to happen.
So you would like to run again, and it's not going to happen because your doctors told you it won't happen, or you're just in so much pain?
Yeah, even just jogging a little bit, like my back will hurt the next day. So I don't know how realistic that is, but that's what I would want.
Okay, well let's say that's one thing. In an ideal world, you want to be able to jog or run more easily, because that's something that you really miss, that your pain has interfered.
Yeah, that's right.
Okay. Those sound like really important, and like I said, certainly the first one sounds like a reasonable goal, and the second one at least could be something that ultimately you would want to be able to do.
Okay.
So, I want you to kind of pick. We're going to talk about different ways to treat your pain, because as I mentioned, treatment is most successful when it includes both medicine and other strategies. And in order to help me choose some of those, can you just tell me a little bit about your typical day, your schedule? Just tell me a little bit about that.
I mean, I'm a grad student, so like days are kind of different, but like my longest work day is probably like 8 or 9 hours maybe of like a lot of sitting and walking around. I bike to work sometimes, and that's okay for my back. That doesn't bother me.
And then how many days a week are you working that length?
Just one long day.
Okay.
So it's only one long day. Otherwise, it's kind of like broken up because, yeah, I have like a 2-year-old, and so we'll watch him sometimes and like running around after him. Sometimes my back will hurt, or like picking him up, my back hurts sometimes.
Okay, so you have a 2-year-old, and who do you live with?
I live with my parents and my son.
Okay.
Yeah.
Okay, and do they help out caring for your son, or is it mostly you having to do that?
No, we trade off, so I'm not watching him like all the time.
Okay, good. I'm just getting an idea of kind of the flexibility in your schedule. You know, if you would
I
have
actually
the
have a pretty
opportunity.
flexible schedule because of grad school. Yeah,
Okay.
so there's like plenty of blocks where I'm like running errands or just doing work of my own or other things like that. Yeah.
Okay. Yeah, because there are some options on here where you could go to resources in the community and just getting an idea of how feasible that would be for you with transportation and that kind of thing is helpful for me.
Yeah, I mean I have a car, so it's fine.
Okay, and then can you tell me a little bit about like your interests or hobbies or what's important to you?
I guess school is important, and my family interests. I mean, I like sports, but I haven't really been able to play that much anymore. Like I used to play frisbee and do gymnastics. But like, yeah, and running, but that's all kind of like gone by the wayside with the back pain.
Okay, those are good. So school's a priority right now. Obviously, your family's really important, young child. Yeah, and sounds like sports were a big part of your life, but maybe your pain has interfered in participating in some of those, especially the running.
Yeah, that's something that I've had to give up.
Okay, great. And do you have like insurance, or would you be able to afford activity fees or things like that?
I mean, yeah, I've Aetna with the school, and then like, yeah, I mean, money's, I don't have like endless money, but like, yeah, it's not like that tight, so I could do some things, I think.
Okay, great. And then, before we keep going and select some treatments, I did want to bring up with you that this questionnaire that I had you fill out.
Oh yeah.
This is a screening for depression.
Yeah, I figured that out.
Yeah, you could tell that it was a screening for depression.
Yeah.
And so your score of 13 puts you in the clinical range for depression, so that just means that this is indicating that you're endorsing symptoms of depression. And so we know that pain and depression can really go hand in hand.
Yeah, I mean, I think my pain makes me depressed because like it's like limited what I can do, and just like feels bad to like be in pain and like not sleeping too. So I can see that being true.
Yeah, absolutely right. You're kind of noticing that cycle of pain makes you feel worse, makes you feel like doing less, and then that kind of makes you it affects your mood, it's affecting your sleep and your coping. Yeah. And so have you ever received any treatment for depression before?
I mean, not really. I did like counseling a while back, but that was not really for depression. That was like before the back pain. So no, I guess, I mean, not really, I guess, but I mean, I could kind of deal with it on my own, like in my own way.
Yeah, and how are you dealing with it now, would you say?
Just like talking to friends, or just doing things that I enjoy, or like telling myself to like just not worry about it, or like move on. So I don't know. I mean, I think I'm managing it pretty well. Okay,
so you feel like you're able to manage it, and those are good strategies, right? Social support, kind of pleasant activities, some distraction, and we just, like I said, we know that pain and depression go hand in hand. So treating depression can be really helpful in alleviating pain. So I'm wondering, would you be interested in therapy resources to help with some of that, to get additional strategies?
I mean, I guess I wouldn't be against it. I'm not sure, I'm not sure I want to go back to therapy now. Like, I already kind of did that, but, I mean, yeah, you could give me a couple.
Okay, so I think you're right, maybe you need to think about it a little more. It sounds like you've got strategies to manage the depression now, and would also be open to getting the resources. So at the end of the visit, I'll just write down some providers that we think highly of, and that you could just have in contact.
Yeah. I mean, my doctor was also supposed to talk to me about like depression meds, I think, but we ran out of time, so I have a follow-up to talk about that soon.
Okay, great.
So that is coming up, I forgot to tell you.
Okay, great. Well, thanks for letting me know. And that's another avenue to pursue for treatment of depression, right? Medication and therapy, or a combination of both. So I'm glad that you'll be talking about that with your doctor.
Yeah.
Okay. And so let's think of some activities now that you can what I'll do is I'll read them to you and kind of see. These are activities that scientific evidence has shown has been good for pain. So I'll read them to you, and just you tell me if that kind of sounds good to you, or nah, not so much.
Okay.
And then we'll pick some and generate a plan. So one would be low to moderate intensity exercise.
Yeah, I mean, that one's kind of out, I guess.
That's out.
I think so. I mean, I just really can't do anything anymore.
Okay. Even like something like just really graduated. Is it something you're not interested in, or you're worried about?
No, I'm really interested, but I can't run. I can't. So I don't really think there's anything I could do there.
Okay. So if you're interested in it, we could talk more about it. Just because it sounds like what you're talking about is high intensity exercise, but let's just kind of mark that one as potentially interested. Although it sounds like it would have to be very graduated and moderated.
Okay.
Another option would be cognitive behavioral therapy.
I mean, I'm not against therapy. Like I've done it in the past.
Yeah.
I mean, I'm not sure if this is the time to go back, but I'm not against it or anything.
Yeah, and we already kind of talked about those resources that I'll give you. And how about relaxation training or hypnosis?
I don't think hypnosis. That one sounds weird, but yeah, sure. I mean, probably relaxing is good. That sounds fine.
Okay, and pleasant activity scheduling. That's where you do, plan to do positive activities during your day.
Yeah, I think I already do that. Like, there are a lot of things that I like, so I don't think we have to do that one.
Okay, and this one I was thinking especially might be helpful for you, behavioral methods to improve sleep.
Yeah, I mean, the sleep thing is a big problem, so that might help.
Okay. Music therapy or music stimulation?
I mean, I already listen to music a fair amount, so yeah, I don't know.
Okay.
Yeah, I mean, I think it helps. It's good, but I think I
So
already
it's
do that
something
one.
you're already doing. Great. Well, it sounds like you're doing a lot of things that are good for pain already. Mindfulness-based meditation?
Sure. I don't really know what that is.
Okay, that's kind of being aware in the present moment, being really attuned to how things are in the moment, being present focused without judgment. It's like meditation.
Yeah, I don't know if that one's my thing as much.
Okay.
I'm good on the sleep one. That one for sure.
Sleep is definitely one we'll pick, and massage therapy would be another option.
Yeah, I mean, I would love to get massages all the time. I'm worried it'd be really expensive. That's the main thing.
Okay, so cost is a barrier, and we actually have some reduced and free massage options.
Oh, okay.
So that could be one. And there's also positive social activities and healthy weight management as well. Either of those jump out at you?
Well, the social ones, again, I think I have that down. The weight thing, I mean, I think it's because I'm not exercising, so those are kind of tied together for me.
Okay.
So I don't know.
Okay. So just in terms of what you have said, what you mentioned beforehand, it sounds like the sleep was definitely one to pursue.
Yeah, I think so.
Okay.
That's been a big problem.
Okay, and then maybe, I don't know, low to moderate intensity exercise as a possibility, even though you said it's hard for you to envision what exactly that would look